it can be achieved fast.
Yeah, you know, that is a problem. You know, I've spent my career trying to build and sell healthcare companies that hook stuff together, you know, that connect things. And in general, the current healthcare industry is not supportive of standards and exchanging information. They have a business model that works great for them, right? They collect the patients in, they collect the information, and they keep it. And that's right. That's a right decision for them. But and there's been a lot of national standards developments around sharing information. HL7 is a big one. But the speed at which AI, in particular, is moving forward, and the complexity of the computations and the data that you need will far outstrip these standards efforts. So I don't think there's a governmental or industry committee group that's going to solve this problem. I think the AI industry will gallop forward, and the standards that are required will be invented as they go. It's moving too quickly for the standards process that I've been accustomed to, and I think it's going to accelerate from there. So I don't know how this will be solved, but I don't think HL7 is going to solve it. I don't think the federal government's going to solve it. I think industry will solve it. They'll just invent what they need to make it work.
Thank you. Over there.
This is for Julian. I love what you're doing, and I was wondering, it seems like in our country, part of the issue is that people don't feel responsible for their health and, you know, maybe expect the doctors, et cetera, to take care of them. And in other countries, there's more of a feeling that they have responsibility because their healthcare is limited. Is there anything you're doing to help patients or consumers say, hey, you're responsible for your health, and by participating and learning more, you can actually help your future, and you can't rely on the healthcare industry to take care of you? I was just wondering if you're working in that area.
Yeah, you know, so I think that our effort really ties in with a lot of current interest in the sort of quantified self movement. So I think that being more engaged in your own healthcare probably has to start with just having more information about your own health. So if you had a better sense of, you know, how often you were going out to eat, how many minutes you spent on the couch in the past week, to the degree that we can summarize and provide that information, I think that at least provides the opportunity to motivate behavior change. I think that sort of larger cultural questions are maybe bigger than one particular app can address, but I think it starts with having people at least see the information in front of them in a way that's more or less biased than their own recollection would be a good first step.
Are you also doing things that make it so that they can feel protected, that their data won't be used against them as opposed to...
Yeah, and again, you know, we are just starting to explore what the partners are for this application and sort of how we're going to use it. So as I mentioned, at the moment, we're really just using it purely in the context of a research study. So very strong IRB protections, very strong consent forms up front. I think it is a question of when this gets moved forward to be a more sort of public-facing application. How do you give people the confidence that you want them to use it? Because you don't want this to be something where it's only taken up by 20%, only by the early adopters, and it gives you a very skewed perspective of the people you want, who often, if they have chronic diseases, you know, if they're over the age of 50 or 60, that group might be the least trusting to start with. So there's a lot of work to do on that front.
All right, so we're going to do the breakout sessions now. So how this is going to work is we're going to have each speaker on one side of the room. And so you guys migrate towards whoever you want to speak to, and it just gives you more one-on-one, face-to-face interaction with them. And yeah, so before we do that, I also just want to do a quick shout out to Frederickson and Barron again for being so great with space and everything and helping us get this event together. And also, of course, a big round round of applause for our speakers again.